We believe that all men are created equal.
To the magnificent mosaic that is America.
From radio beacon to radio beacon. I have a dream. Change has come to America.
Believe me.
Help is on the way.
Knock, knock. Who's there?
It's a figment of your imagination.
Randi Rhodes Show. Turn up your mind.
It's reinstatement day, you bastards.
What I'm talking about, Steve, is what I have been doing since January 9th. All the evidence I have, everything is going to go before the Supreme Court, and the election of 2020 is going bye-bye. It was an attack by other country, communism coming in. I don't know what they're going to do with it after they pull it down, but it's
hang on a second.
Hold on. Donald Trump will be back in office in August.
It's reinstatement day. Mike Lindell said August 13th, which was a Friday the 13th, which is perfect, for the sequel to Trump 1, sort of like Freddy or, any of the Jason, Michael Myers, it was going to be a sequel to the first horror show of a Trump presidency. But he did say today would be reinstatement day. He actually named the date. He said it would be today. He said it would be August 13th. And I went to CVS. I went and I tried to buy a happy reinstatement card. Happy reinstatement day card. There's no cards. I guess everybody bought them all. There's just no cards. So now we're going to all have to search for a happy belated reinstatement day card. I don't know. But I would tell you, last night was so funny. I was tweeting out, the little segments that I tweet out. And so I was doing that work. And, I'm very lucky. I get followed by some super really smart, unbelievably funny, intelligent. Some of them are actual prolific writers like Anne Lamott. I don't know if you've ever read any of Anne Lamott's work, but Anne Lamott is a prolific writer of, I can't tell you how many books. I really, honest to God, do not know the answer to how many books Anne Lamott has written. But some are fiction, some are nonfiction, some are on faith, some are novels, whatever. Anyway, Anne is incredible. She's amazing. And so last night she tweeted out, "I'm so excited that Trump is going to be reinstated tomorrow. Wow, I really didn't think that would happen. So I think I'll celebrate tonight at Target." All this stuff I never let myself buy, like the gallon jar of cheese balls and individual packets of nail polish remover. I'm going for it. So I tweeted back at her. I said, I'm going to blow it all on the decorative aluminum Lively Kraken knick-knack and possibly go for the pet stroller. She writes me back, "Oh, Randi, I love you. I've been listening for so long, blah, blah, blah." She said, "Why don't we just get together? We could buy some compression socks, a new lipstick, and eat all the chocolate." There are people out there that are literally sad. They are saddened. They are hurt. They are just discombobulated. They are, just looking there you can't spell conservative without con. And now they know it because the con has ended. It just snapped, okay? It has gone as far as it could go, and now it's snapped. There's nothing left to the big lie, except for the voter suppression efforts. Except for that. I mean, this is just so unbelievable how Mike Lindell literally named the day that we would and I kept telling him, I tried to tell him. We all did. We all tried to tell him because nobody knows if Mike Lindell is just grifting or if Mike Lindell believes this swill or if Mike Lindell wanted to have a symposium so he could run, 66% off my pillows if you dial in now. We don't know what his deal is. All we know is he's an ex-crackhead, and I hope it's ex. Please stop typing. He's an ex-crackhead, and I hope it's an ex. And he just insists that the election was stolen and that the Supreme Court will somehow insert itself, even though they're not in session, and they will rule 9-0. Stop. No, it's not you. It's him. that Donald Trump won. I mean, he just kept insisting. Here he is actually naming the date.
By the time the morning of August 13th, it'll be the talk of the world going, hurry up. Let's get this election pulled down. Let's right the right. Let's get these communists out, that they've taken over. And you'll see, when I say that, and they'll say, well, what's going to happen to all the people that were involved? I don't know. Right now, the biggest concern is getting this election pulled down. Donald Trump won. I mean, it's pretty simple. Okay, and there were many down-ticket senators, too, that they did, too, and stuff. You'll find all that out.
Do you have reinstatement day off? Do you? Because Mike Lindell does. His symposium has ended, and it ended with a page of gibberish, actual gibberish. That's what he disclosed to his hundreds of thousands of people watch this thing. I swear to God they did. This is what's so frightening, is that there are people in this country, hundreds of thousands of them, that watch Mike Lindell's grift, that watch that symposium, that watch that fraud, that watch that deceit, that watch that deception. And they were hanging on every word as if they understood anything that was scrolling on their screen. And what was scrolling on their screen, in case you don't know, was gibberish. It really was. And, computer scientists have looked at it. There are many articles today, if you care to read them, about how it was gibberish. And now the psychological masters of the universe are trying to figure out, did he believe this? Was he flattered because Trump asked him to take a look at this? Did he understand any more than most people understand, the Journal of American Medicine or the recommendations from the American Pediatric Association? Do they understand what they were looking at? Were they just flattered that he asked them to look at it with him? I mean, no one knows what the motivation was, but I will tell you what the result was. The result was violence. The result was violence, and there's this massive overlap in the Venn diagram of people who won't get vaccinated. There's a giant overlap of those people and the people who believed Mike Lindell was onto something and stared at the gibberish. And those people are literally dangerous. Those people caused violence in this country. Those people actually engaged in insurrection. Those people literally beat police officers with flagpoles and hockey sticks and crutches. They tased them. They traumatized them. They said these police officers have told you that in their entire careers they had never been engaged in hand-to-hand combat like that. It looked like something out of a medieval tunnel episode of, what's the winter is coming thing?
Game of Thrones.
Yes, Game of Thrones. And that Donald Trump was tweeting the logo to Game of Thrones, and The Godfather. I mean, it's just so sick. And so that's what all this lying has led to. And now it's leading to death. It's literally killing people. It's literally taking the lives of ordinary human beings who somehow want to believe America sucks. They need to believe that America's being run by a group of baby blood drinking pedophiles who have serpent DNA. And they believe it so hard that they will kill their children, not just physically by taking them to Mexico like that guy from Santa Barbara yesterday that we were talking about, but also through disease. They will actually allow their children to get diseased, to be hobbled, to suffer, maybe die from a completely preventable disease. Now, I will tell you that school started here 2 days ago. Mississippi started school last week. You have an entire school district in Mississippi that is under quarantine. Florida has at least 500 kids under quarantine. We've already seen the deaths of teachers and staff workers at schools here in Palm Beach County, let alone Broward County and Miami, also very huge counties. And our governor, who is a comorbidity, meaning he contributes to our dying from this preventable disease, is now pledging that what he's going to do is not mask people, What he's going to do is set up mobile Regeneron infusion centers.
all things Randy at RandyRhodes.com.
Go for launch.
Speaking truth to power, the Randi Rhodes Show.
It was a curious news conference held by Governor Ron DeSantis. He didn't say a word about the huge increase in cases in the state or the spike in hospitalizations. Instead, he talked exclusively about a treatment regimen the State Department of Health is going to start providing through mobile clinics dispensing monoclonal antibodies and the drug Regeneron. Now, if that sounds familiar, it's because that is the treatment former President Trump got when he came down with COVID.
If you're vaccinated or unvaccinated, if you're in those high-risk groups, you can still do the monoclonal antibody. The only issue I think that doctors would tell you is if you're not vaccinated, high risk, you come in, you get infected, come in and get it, absolutely. You get the treatment. You have to ask the physician at what point in the future, if you do want to get vaccinated, do you have to wait because there's antibodies and they want that to be able to clear. But that's really, at the end of the day, the only major thing that you need to look at.
The governor is urging people at high risk, the elderly, the obese, people with diabetes, cancer, at the first indication of COVID to get the monoclonal antibodies and the shot of Regeneron. He says doing that early on will reduce the risk of hospitalization by 70%. And one other thing, at this news conference today, neither Governor DeSantis nor anyone in his entourage was wearing a mask.
What does it cost to get Regeneron as a treatment? Just ask him. Why do we have a governor in Florida who wants to do mobile laboratories to administer Regeneron for a preventable disease rather than urge people to get a free vaccine? Something tells me that he may, I don't know, be invested in Regeneron. Some doctor, nurse, somebody who codes out there for medical procedures might know what the cost of administering Regeneron monoclonal antibodies is versus the free vaccine. Don't you find that a little bit suspect? I mean, this is just so unbelievable. He wants to do mobile laboratories, I swear, mobile clinics is what he's calling it, of Regeneron so that people can be treated for a virus they never need to get because it's preventable. What the F is going on in the big F? That's what Florida is. It's just like, I mean, this is amazing. And by the way, one of the doctors at the University of Miami Medical School said Regeneron is effective, but it's not a cure-all. He said, quote, the governor is saying 70% reduction in hospitalization. So he's kind of giving the more optimistic, more flowery view. The reality is it's much less. So he's lying about its effectiveness for those who contract COVID and that they should somehow go to one of these rolling laboratories and get a shot of Regeneron, but they won't get a shot of Pfizer or Johnson & Johnson or Moderna to prevent a virus that's preventable. Oh my God. We are so completely gone in this country. I mean, like literally gone. And you know, this goes along with the news of the census. I'm sure you've heard already. I think it's like 43% of America is not white. 43% is not white. 57% is white. That is a very, very, very low amount of lily white people in this country at this point. And I don't know what white people ever expected would happen when they decided that they would slap fentanyl patches on, that they would take OxyContin as a candy. They would munch roxycodone. Maybe they would even snort it, smoke it, drink it, shoot it. Then we have the alcoholism problem. Then we have the methamphetamine mobile laboratories. You know what I mean? I mean, did you really think your penis was still going to work? Did you really think that you were going to be able to, survive? And now COVID's killing you. So for all these crazy white supremacists who feel that they're being replaced, you're committing suicide over and over and over. You are choosing the most unbelievable path towards your own destruction over and over and over again. And then you're going to sit there and rail against the melanin content of the remaining people. How twisted a country have we become? How incredibly lunatic fringy are we? I don't know why people thought that they could do whatever they wanted to do, including shoot each other, including, drinking and mixing it with, Oxy or rock, and expecting us to come get them with Narcan, right? We're the ones that have to come get you. We're the ones that have to revive you. We're the ones that have to do that thing. And then you're going to be shocked and dismayed when you find out that you won't take responsibility for your own health, even when it's a preventable virus. And over 600,000 of you have died in a year. And all of a sudden, you're going to wake up to the fact that you're a dying breed. Of course, you're a dying breed. You have abused yourselves. I personally can't wait. I can't wait. I'm just so done with it. I really am. This whole entire COVID thing, the exhausting nature of people, the way that you can present them with simply explained facts, and then they just move on to the next thing, and then the next thing, and then the next distraction, and the next distraction, and then this thing, and then what about that thing, and what about Obama? Do you know what I mean? I mean, a man who hasn't been president for like almost 10 years. What about him? It's never ending, and it's exhausting. And people are getting really tired of risking their lives for you here in this here country. And I tell you, when you look at Mississippi, you look at Alabama, you look at Louisiana, you look at what their medical profession, 800 doctors. I just want you to know this. 800 physicians, 800 of them wrote a letter to the governor of Florida, wrote a letter to Ron DeSantis saying, cut the crap already. Protect your freaking people. Your job is to see to the general welfare of the people. It's the oath you took. It's why you're an executive in the state of Florida. It's why you're the top executive, and you refuse. You shirk your duty. You literally won't do your job. People are dying, and we're telling you they don't need to. We're telling you, stick a mask on these kids. We're telling you, if they don't want to get a vaccine or they're ineligible to get a vaccine, like the below 12s, the numbers of kids between 12 and 17 in this state is so low. It's so low. It's like between 12 and 17. It's like 12%. And they're eligible. It's their parents. They won't do it. And now they want to send their kids to school without a mask. Then the kids are going home. And now you're seeing households get infected. I mean, it's just so, it's an endless loop of death. And, oh, by the way, Large Marge, she is really gigunda, okay? It's all that CrossFit stuff that she does. She's saying we all have to die sometime. What? Yeah, that's her cure. We all have to die sometime.
Call in, connect. To speak to Randi, call 561-270-3844. 561-270-3844.
Does Delta behave differently vis-a-vis kids than the kind of the previous iterations, which fortunately have a very minor impact, particularly on young kids? And the answer is, in terms of the hospitalization percentage, we've not seen any change in that in Florida.
He's lying.
Clearly, we're at the top of a wave here, so you're going to see more cases and infections diagnosed. It's also important to point out that of the COVID-positive patients in hospitals, about 25% on average are not being treated for COVID. In other words, everyone gets tested who goes in, and if you're positive and you have a different procedure, you should specify it as COVID positive patient because they want to isolate and make sure you're not spreading it. Pediatrics, depending on the hospital, it's typically between 20 and 40% pediatric COVID positive inpatients are incidentally COVID positive. In other words, they're there for a different reason. They get tested when they come in, and then they happen to test positive for that, but they're not being treated for COVID.
He just lies. He's just lying. He's lying, and it's really deadly and it's really dangerous. Here you have in Tampa hundreds of kids who had to be sent home from an elementary school. 10 of its 63 staff members tested positive in a single day. Thursday morning, all Tampa schools, their case tracker showed 71 students and 198 employees had tested positive over the past month. In Pinellas County, 4 kids, 23 staff members got a positive test result. In Pasco County, which is, these are not major, 85 students, 28 staff members. Sarasota, 145 students, 39 employees. Citrus County, they have 16,000 total students. 6 employees are positive. 25 of the kids are positive. And, this man is just lying. He's just standing there lying, and he's offering treatment for a preventable disease as a way to fight the disease. It's so ass backwards. In Palm Beach County, this is where I am, okay? 500 students. School's been back since, Tuesday, I think. So Tuesday, Wednesday, Thursday, 3 days. School has been in session for 3 days here in Palm Beach County. Nearly 500 students have been quarantined because of COVID just 3 days into the school year. The superintendent of schools here in Palm Beach County made the announcement yesterday, right after DeSantis maintained that there will be no masking in schools and that the kids who have COVID, it's an incidental thing. They're in the hospital for other things. They're not being treated for COVID. And that's just not true.
What is your greatest concern right now, and who do you blame for the crisis that you're already beginning to see unfold here?
So our goal was to get our students back in person on our campuses. We truly believe, and research now shows, that the best place for them, both academically and socially, is to be in the classroom. And our goal is to keep kids in school. And what I'm concerned about is we've gone as far as we can within the state law to require face coverings for both our students and staff.
So be direct, who do you blame?
Well, I guess, the governor's got to take responsibility for establishing the ground rules we're operating under. And this ability for families to opt out is leading to more cases, which is ultimately going to send more kids home and deprive them of that traditional classroom experience.
So here's what happens, okay? The lunatic fringe opts their kids out of wearing a mask because Ron DeSantis has allowed that to happen. Okay, here's how many kids we have in our school district. We have 167,000 kids. 6,300 parents opted their kids out of having to wear a mask. And in just 2 days, we saw 500 cases of COVID in kids. 500 in 2 days. In 2 days. I mean, in Miami, it's worse.
In a span of just 24 hours, 3 Broward County school teachers and a teacher's assistant have passed away due to COVID. This is leading to more teachers and other school leaders demanding masks be worn at schools. Also joining them in this plea are local doctors. So far, more than 800 Florida doctors have sent a letter to the governor demanding he repeal the anti-mask order.
800 doctors. But he knows better. He knows better. Just like Mike Lindell is suddenly a computer scientist, and he understood the gibberish that he was scrolling on his screen to claim that the Chi-Coms with thermometers had hacked into Dominion machines that were not connected to the internet and flipped votes from Trump to Biden. He was so sure of the confidence with which people who know nothing spew their information, their false disinformation, is just almost stunning. Strong and wrong seems to be the posture that the con men in the conservative party are, exuding. Strong and wrong. Always strong, always wrong. Always wrong. And now you can't afford to be wrong because the children are getting sick. They're suffering. Some of them will have long COVID. Others of them will not. Some will have no symptoms and long COVID. Some of them will have no symptoms and be fine. Why do we even want to see those numbers when it's totally preventable? Monoclonal antibodies in mobile laboratories? What are we, Iraq? Oh my God. It's just so unbelievable. It's an amazing. This is Anna Fusco. She is the president of the Broward school teachers.
Yesterday, I got reported on 4 employees that passed away in Broward County. 2 at one school, 1 at another, and 1 at another. So we had 3 teachers and 1 of our support professionals pass away from COVID.
I'm so sorry, Anna.
It is. It was a sad day for 3 schools, because our teachers walked back on campus with their principals, and they got the news from their families that they wouldn't be reporting because that they passed away from COVID. So I do know one of the teachers that contracted COVID was not vaccinated. I do not have the data or the information on the others.
So now we found out that 3 of the 4, we don't know about the 4th yet, but 3 of the 4 teachers who died of COVID were not vaccinated. We're waiting to get the information on the 4th that died. 15% of all new infections nationwide are in our children. And the rate of vaccination among our children is so freaking low because of lunatic, fringy people who just don't trust science, don't trust government. They don't trust anything. They don't trust anybody except for Marjorie Taylor Greene and Donald Trump. I mean, it's just the sickest thing. So what do we have here? We have 12% of 12 to 15-year-olds vaccinated. 12% of 12 to 15-year-olds, they are eligible for vaccines, right? And between 16 and 17 years of age, 17% of them are vaccinated. These are the kids that are going to school. Now, the 12 and unders aren't eligible yet, and they are depending on us, the herd, to protect them. And we're not doing it. So don't ever tell me you'll take a bullet for your kid, because you won't even take a shot for your kid. You won't even allow your kid to get a shot, even though your kid has been vaccinated 1 million times. Yes, 1 million is the correct number. 1 million times. I joke. But your kid has gotten measles, mumps, diphtheria, tuberculosis, chickenpox, rubella, polio, on and on it goes. Somehow this one, oh no.
This is the Randi Rhodes Show. To speak with Randi, dial 561-270-3844. That's 561-270-3844.
The FDA giving the green light to booster shots, authorizing an extra dose for those with weakened immune systems. The qualifying group is small, about 3% of the U.S. adult population, but the CDC says they make up more than 40% of hospitalized breakthrough cases. But Dr. Fauci telling Craig yesterday, booster shots for other Americans may be coming.
No vaccine, at least not within this category, is going to have an indefinite amount of protection. Inevitably, there will be a time when we'll have to give boosts.
The news coming as the Delta surge is being felt on the front lines. A massive spike in COVID calls stretching San Antonio EMS too thin.
Today, for 26 minutes, we had not one EMS unit available in the entire city.
Oh my
And
God.
hotspots like Memphis, the sudden rise threatening the city's 911 system. Now on pace for its busiest month ever.
When you may call for an ambulance and we may not have one available.
Now some cities taking new measures. New Orleans requiring proof of vaccination or a recent negative test at virtually all venues, including bars, restaurants, and nightclubs.
Don't look for the loopholes. Look for your vaccination card and be prepared to show it.
San Francisco going one step further, becoming the first city nationwide to mandate full vaccination for nearly all indoor activities. Meanwhile, the mask divide only deepening. In Florida, a mask-optional school facing consequences on day 2.
So we finished the second day of school with 440 students in quarantine.
Oh my God.
Stemming from 51 cases of staff and students.
Jesus. Mississippi, there is an entire school district under quarantine. They're not going to be able to go back to in-person learning in Mississippi because of the recalcitrance, the ignorance, the actual lax attitude of parents with regard to their children's health and safety. It is unbelievable that a disease has politics. I got news for you. SARS-CoV-2 Delta, it doesn't have politics. No, it doesn't give a damn about politics. It wants to live. And apparently, it wants to live more than you do. Therein lies the dilemma. Tom in Florida.
Yeah, Randy. Happy 13th. I don't know if you were aware that there is a shortage of the N95 mask, which
there isn't. No, there's not.
There isn't?
No.
I called every pharmacy, Walmart around, none of them have it. But here's the good news. If you can't find one, go to a paint store. They've carried them forever because I used to do some painting and body work, and we would always have the N95 mask. They have them.
They're flying off the shelves again, but they're not scarce. There's no scarcity. So, I don't want you to give people an excuse not to go and.
No, I'm just.
Yeah.
I have. There's no profit for me in this on paint store. I'm just saying if you can't find one, which, like I said, I called all over northern part of Florida, and they were either out of them or they didn't know if they were going to get any more. But I called a couple of the paint stores, major. I'm not going to say their names, not an advertisement, and they carry them. They're a little pricey, but Dr. Fauci was on something CNN or whatever it was the other day. I saw it, and basically he said that yes, and N95 is your best protection.
Yeah, it is. It absolutely is. There's no question. N95 is the best protection. KN95 is the second best. The surgical masks are the third best, and a piece of cloth is the last best. So that's kind of the order. Conrad in California.
Randy, I'm a first-time caller.
Oh.
Listen, you've teed me up perfectly when you were mentioning the new census numbers.
Yeah.
Now, I'll give you my preface first, and that's that we need to stop using the term majority, minority, because of all the fragile white people. We have we need to start using the word co-equal. I was having a beer with my friend. He's one of these fragile white guys. He'd had a few. He brought up the whole thing about, whites are going to be a minority in America, or there are less whites in the whole planet than there. Something like that. It was dying breed. And I looked at him and said, there are more whites on the planet than there ever have been before. And that rocked him up back. And then he says, what happens? Well, here in this country, when the whites are in the minority, then the people with a healthy skin tone will finally get to make decisions as co-equals. Yay.
Yay. Yay. I know.
So that's a way for it to, I think, to assuage the fragile white people about.
I love that you call them fragile white people.
Oh God.
They are snowflakes, aren't they? They they fall apart. They melt away. They just become just a bucket of water. Do you know what I mean? They just yeah. It's so sad. It really is so sad.
Yeah, I was born in Venezuela, and Caracas is just like New York. I came to the States when I was 7. And I mean, there's every kind of people you can imagine,
I know.
And I hear people talk about tribalism, and I'm like, what are you talking about?
Yeah, no, it's not tribalism. I had this conversation. It's funny. You were having it with your friend. I was having a conversation like this last night with the Howard, and Howard was saying exactly what you're saying. But he said, they're so tribal. And I said, they're not tribal. They're juvenile. They're babies. Their brains operate at the same level as a 2-year-old. Okay, they can't help themselves. They can't figure their way out of the bathroom. They can't figure out how to pull their pants up anymore. They've just lost the ability to comprehend what they read. So, it's not tribal. Tribal makes them sound strong, like they're part of some. They're just babies. They're juvenile. They're idiots. And when you have babies protecting the lives of babies, this is what it looks like.
Yeah.
I mean, it's an amazing thing. It truly is a lack of comprehension and a lack of being able to figure out the world around you. And it's not tribal. It's simply they're lost. They're lost. They just never matured. Their brains didn't grow. And you know, I'm starting to think that it's either malnutrition at a young age, which we were talking about yesterday. By the way, ever since we did the child tax credit, the $300 for kids under the age of 6 and the $250 for kids under the age of 18, hunger in this country has decreased by 25%, and it's only been one round. It's only been 1 month. But it's the difference between not wanting to feed your kids and not being able to feed your kids. These people are choosing death. They are choosing to let their kids get sick. And there's something very, very juvenile about saying that my belief in Donald Trump is paramount to my children's health and well-being. Okay, there's a difference between people who voted for Donald Trump and said, all right, I just wanted to try something different. It didn't work out. Move along. Nothing to see here. Yeah, they're wrong about the nothing to see here because it's the gift that keeps on giving. But with the big lie and the voter suppression efforts, etc., and I think, you know, smart people know that. But it's the difference between those people that said, let's just try something different, and the people who are willing to die for him. I mean, it's just because either they ate lead paint as a child, or they were malnourished as a child, or they're alcohol or drug addled at this point in their lives by, you know, over drinking, over snorting, over shooting, over medicating with some damn thing that grows from poppies. You know what I mean? I can't even explain. It's like, used to be religion was the opioid of the masses. Now guess what? Opioids are the opioid of the masses. How did you think that you were going to be, you know, survival of the fittest being what it is and all, and Darwinism being what it is and all? How did you think that you could naturally select to kill yourself and somehow maintain your majority? I don't even understand it. I don't know what they thought was going to come of all this, but now you can see what's come of all this. And I personally can't wait to have somebody else in charge, somebody else drawing the maps, somebody else organizing elections, free and fair ones, somebody else legislating what the justice system needs to be, because white people have failed miserably on every score, on every category on the scorecard. Just miserable. And now they're taking us with them? No, I don't think so. They're taking their children with them. That's frightening enough. Frightening enough. And where is Donald Trump with his vaccine? Why doesn't he say something?
Mary had a little man. The fault. We believe that all men are created equal.
To the magnificent mosaic that is America.
From radio beacon to radio beacon.
I have a dream.
Change has come to America.
Believe me. Help is on the way. Knock, knock. Who's there?
It's a figment of your imagination.
Randi Rhodes Show. Turn up your mind.
Well, when I woke up and saw Tennessee, my home state, trending, I thought to myself, because I knew that it wasn't going to be anything good. I didn't see that and think, oh, I bet we won a chicken award. Maybe somebody caught a really big fish somewhere. I know it wasn't a football team doing anything worth a damn. I wonder what it could have been. Oh, a bunch of rich, white, entitled troglodytes threatening the lives of people trying to protect their children at a school board meeting. Yeah, that sounds much more accurate. That makes sense. You know, I've been kind of thinking that Tennessee's time to shame where COVID was concerned had to be coming soon. All the shit with Florida and Texas is kind of how the southern states work. They just sort of take turns seeing who can be more embarrassing about an ostensibly simple subject. So I knew that this was coming, and it finally did. A bunch of mouth breathers in Franklin, which is one of the richest parts of Tennessee, I would point out. These are not my fellow trailer Americans here. These are people with big dumb houses and big dumb trucks that pull big dumb boats with big dumb flags on them. That's who these people are. Went ballistic at a school board meeting because the board enacted a mask mandate. And, you know, honestly, I knew I had to front load this video with jokes because I watch this I watch these people just frothing at the mouth, essentially saying, I'd rather my child die in a hospital bed than be a goddamn liberal queer. And I know that they mean it. And I just, as somebody from Tennessee who has children, and I have close friends with children in Tennessee, I've got nieces and nephews. I got a new nephew on the way in Tennessee in a couple months. I've watched these people do this shit and I know that they mean it. And really what I mostly think is y'all don't deserve the rest of us. You don't deserve this country and the freedoms that it affords you that you consistently fail to actually understand. You don't deserve these doctors and nurses and teachers and administrators who, despite everything, are trying their very hardest to protect you and your family from your own malicious stupidity. And really, the rest of us in the world at large would be better off if this virus was even more efficient at giving y'all specifically what you are so clearly asking for. I'm tired of this shit, man. To end on a somewhat hopeful note, apparently that school board got twice as many letters of encouragement from constituents about the mask mandate as it did from people like this. So they are in the minority, but we'd all be better off if they were an even smaller minority, right? Jesus, I love y'all.
Thank you, Trey. Trey Crowder. Trey Crowder. Okay, so it's not just me, the New York liberal, that is saying numbers and things and, death tolls and, vaccination levels and, that 12 to 15-year-olds are not vaccinated even though they're eligible to be vaccinated because their parents are morons. No, it's actually rural Americans who see it too. It's actually Texans and Tennesseans and Alabamians and Mississippians. It's actually people in Arizona. It's actually happening. And here is what it takes, okay? This is what it takes for people to wake up and get vaccinated against a completely preventable virus. This news here: Alabama, Texas, Georgia, Florida, and Mississippi, their hospitals, our hospitals, are at 90% capacity. However, in Arkansas and Tennessee, there are 0 ICU beds. 0. Our hospitals in the southern tier of this here country are about to fail. And that is what this was all in preparation for, to prevent the failure of our hospitals. And now the burden has become too heavy because of these recalcitrant ignoramuses.
Troglodyte's
a good word. It's a very, very, very good word. But listen, we've been warned. We were warned yesterday. We were warned the day before yesterday. We were warned at the beginning of this pandemic. I can't tell you how many people came forward and tried to warn you that what would happen if too many people refused to take care of themselves, if too many people, this is before we had a vaccine, okay? They understood that if too many people would not wear a stupid mask, a stupid piece of paper over their face, okay? If they wouldn't do it to protect their communities, their community hospitals would fail. And that ice trucks would start showing up, okay? And that people would be backed up in parking lots unable to get tended to when they shot each other or when they overdosed on the roxycodone or on the fentanyl patch or on the alcohol or on the combination thereof, okay? That we would not be able to help you. And that has happened. So now, and you got Large Marge over here saying, well, we all got to die someday.
Once the vaccines are approved by the FDA, we are going to see the mandates for vaccines ramp up far more than they are right now. They're going to be mandated, and I fear they'll become law in some cities and some states. Biden would love to make it the law of the land. And I think that's completely wrong. Again, I'm not anti-vax. I am completely for people being allowed to make choices, medical choices for themselves and their families. And I don't think the FDA should approve a vaccine that it doesn't seem to be that effective, especially with COVID-19 raging all over the country. At least that's what the media tells us every single day. But I've talked to local hospitals here in my district and here in my state. Yes, the waiting rooms get full, but guess what? The waiting rooms are full of all kinds of things, not just COVID, some, car accidents, trauma, other illnesses, cancer, and so forth. But they're seeing about 30% of those numbers being COVID cases. So while the news tries to tell us the hospitals are slam-packed with COVID, that's just not the case. Everyone needs to get back down to common sense and remember that, we're human. We can't live forever. We are going to catch all kinds of diseases and illnesses and other viruses, and we get hurt sometimes.
She's a sick freak. Okay, first of all, the government can mandate vaccines. They do mandate vaccines, and we've been doing it since 1777. I told you about George Washington mandating that his Continental Army get vaccinated against smallpox. In 1905, there was a case about whether or not Massachusetts school children had to get vaccinated in order to go to school, and the Supreme Court said, yeah, they do. There is a community right to self-defense against a pathogen, and if there is a tool in the toolkit, then it ought to be deployed for the benefit of the many, to see to the general welfare of the people. 1922, another case, yes. And your kid cannot go to school in almost every school district I believe it's every school district in this here country that says that your child must be vaccinated against polio. Your child has to be vaccinated against rubella and measles and mumps and chickenpox. I mean, where in the world do they get this crap? Why do they do this? Why are they bottom feeding and trolling people with fake and false information and a completely made up history of the United States of America? I don't know why they do it. I don't know. I guess she sees the money rolling in. They all do. Preying on the stupidity of the population, and they see an opportunity and they're going to take it. It's really sick and twisted. But I have to tell you that yesterday, Dr. Alan Jones at the University of Mississippi Medical Center, he tried to stand on a stage yesterday and tell you the hospitals are going to fail here. They're going to fail.
Since the pandemic, I think the thing that hospitals have feared the most is just total failure of the hospital system. And you know, if we track back a week or so, when we look at the case positivity rate, the number of new positives that we're seeing, the rate of the testing positives, and then the rate of hospitalizations based on what we are seeing, if we continue that trajectory within the next 5 to 7 to 10 days, I think we're going to see failure of the hospital system in Mississippi.
Great. I mean, great. And it's happening. It is happening. And so when she says, well, we're all going to die. Yeah, but not today. Well, we're all going to die. Yeah, but you don't have to die in a parking lot. Yeah, we're all going to die. Yeah, but you don't have to die from a preventable disease. It's all about money. Fundraising.
All things Randi at RandiRhodes.com.
Go for launch.
Speaking truth to power, the Randi Rhodes Show.
More than 10,000 Texans are in the hospital now fighting COVID-19.
In Dallas, we have 0 ICU beds left for children.
Oh, God.
That means if your child's in a car wreck, if your child has a congenital heart defect or something, needs an ICU bed, or more likely, if they have COVID, need an ICU bed, we don't have one. Your child will wait for another child to die.
At one hospital in Tennessee, no beds. There are no beds, says the chief medical officer. And in Memphis,
there's times when you may call for an ambulance and we may not have one available.
Oh, God.
In these states, more than 90% of ICU beds are now occupied. The situation is worst in states where vaccination rates are lowest. In Mississippi, just 36% are fully vaccinated.
Almost 8,000 Mississippians have died from COVID.
Wow.
How many Mississippians have died from the vaccine? 0.
In Arkansas, 38% fully vaccinated.
It's been really touch and go.
Kyle Buttram's baby is in the hospital with COVID. He's pleading.
Get your vaccine so that another child doesn't have to do this, and another family doesn't have to send their kid away.
You people who are refusing to get vaccinated or wear a mask or even get tested, there's something really wrong with you. You need help. You need to go to Talkspace and find some therapy, because 0 people have died from this vaccine. And over 620,000 Americans have died from this disease. It is preventable. Our hospitals are overwhelmed now, so that if my mother has a stroke, oh well, too bad, she dies in her apartment. You get into a car wreck this weekend in any of these states, Texas and Georgia, Florida, Mississippi, Arkansas, Tennessee. No room at the inn. What the hell is wrong with you? Diane in Arkansas.
Yes.
Hi.
Randy, I have many points to talk about what's happening in Arkansas, but I'll make this brief. By the way, your show and the way you talk, you're preaching to the choir. My husband and I watch you almost every day. Your outrage is our outrage. What you're thinking is exactly what we're thinking. We just want to let you know that. Number one, they had a Arkansas school district in the western part of the state that opened. So far, 1,000 staff and students are in quarantine. We had a charter school open in Little Rock a week and a half ago. I'm not sure the number that's in quarantine already. I had a conversation yesterday with my local hospital and my doctor's clinic because they're allowing people, employees that work there, to come to work, interact with patients, have not had their COVID vaccine. One of the lab employees in the hospital died of COVID. And I called both of them, and I said, I'm vaccinated. I do not want someone taking care of me that could give me COVID, even though I'm vaccinated. Now, how sick is that?
Well, it is amazing that there are healthcare workers who are going into a hospital setting unvaccinated. I mean, that just blows your mind. But it tells you that this brainwashing thing is not just for the low IQ types. It's for the low information types. You could be, the former CEO of Overstock.com. You could be the CEO of MyPillow and still be brainwashed into believing some damn conspiracy theory. It is so virulent. It is so deadly. It is so widespread in this country. And
think about this. We're in the middle of a major pandemic. In Arkansas, they just stated what the vaccination rate was. What happens during a pandemic when you put these people close together? The virus spreads, especially COVID. What could possibly go wrong? How dumb do you have to be? And children are filled up in ICU in the Children's Hospital in Little Rock as I speak, and some are going to die. Now, there are attorneys out there making mention of parents suing teachers and the school district and whoever else for endangering children. And I got one final point. I'm a substitute. I've been a substitute in the local school districts around Little Rock for 7 years. I got one thing to say. A dead child can't learn and can't make up the socialization for lack of school. That's all I have to say.
Thank you, Diane. Thank you. I hear you. We all hear you. We all know that what you said, with the exception that it's not just dumb. It's not dumb. There are many smart people, educated people, highly educated people who are buying into these conspiracy theories. It's propaganda. And the reason why propaganda is so deadly, so dangerous, is because it works. And it works on very smart people, otherwise smart people. There is an emotional immaturity about some of these people who are very educated but who buy into these conspiracy theories. It's an emotional deficit. It isn't a inability to decipher math or to read no. It's wanting to believe that something bigger than you is in control of the outcome before you do anything, or no matter what you do. It's people who literally want to believe America sucks. That's basically the distillation of everything here, right? So you have people who want to believe that there are pedophiles somewhere in the universe, right? Somewhere in the located somewhere globally, someplace in America, could be in Europe, could be in China, could be whatever. But that there's this cabal of these people who are so ill-willed and so willing to kill that they are controlling the outcome no matter what you do. That's an emotional deficit, to want to believe that. To want to believe that not only is there a cabal of people, but that they're of a certain persuasion, and you can assign them a persuasion in your mind, or that they're drinking the blood of children, or while children die on top of it, okay, for real. Or that they're pedophiles, or whatever you want to, characteristic you want to assign to this cabal that's doing it to you. That is an emotional deficit. It's not being smart or stupid. So that's the only issue I have with what you said. But yes, people are willing to let their children die. They're willing to let people in car accidents die, people with heart attacks and strokes die for their conspiracy.
Call in, connect. To speak to Randi, call 561-270-3844.
561-270-3844. Let's talk about pregnant people. The CDC has some new guidance based on some new data that found that there's no increased risk for people who are pregnant to get the vaccine. What do you say to people who still may be hesitant about this? They may still be worried.
Well, the data are really very, very strong, Vlad. If you look at the tens and tens of thousands of pregnant women who have gotten vaccinated, there's no safety signal of concern at all. Balance that against the fact that we absolutely know that when pregnant women who are unvaccinated, when those individuals get infected with SARS-CoV-2 and get COVID-19, it is very detrimental not only to the woman herself, but to the fetus. So that's the reason why the recommendation has gone from could get vaccinated to should get vaccinated.
Oh! Okay, pregnant women, women trying to get pregnant, please get the vaccine. One of our close family friends was one of those who was trying to get pregnant, and she didn't want to get the vaccine. We all just glommed up. No. You know what it took? Her husband got COVID. Bad. Really bad. Her husband had to be alone in the apartment without her. She had to go live with her mother. Finally got vaccinated. Yay! Another couple friend of mine, okay, both of them, husband, wife, believed everything they read on Facebook. Everything they read on Facebook. That's where they were getting their medical information from. Trumpers. And he's in the ER, and she's at home, unable to lift her head off the pillow. I mean, just this week alone, I learned of like 6 people in my orbit that got COVID badly. Pneumonia, one in the ER, another one has to isolate all by themselves. I mean, it's just, it's an amazing phenom. And still, no vaccine. One of my friends, I won't even tell you who, you don't know her anyway, but one of my friends refused to get the vaccine. She's a Trumper, so is her husband. And they absolutely, positively believed everything that they were reading on Facebook. That is where they were getting their information about everything from. They refused to get vaccinated. They are my age, okay, which is not a great time to say no to a vaccination that prevents a disease that affects your lungs, you know. She got vaccinated, but doesn't want me to tell anybody that she got vaccinated. Know why? Outside of our little group, peer pressure in her other group. Peer pressure. You're talking about women and men in their late 50s, early 60s succumbing to peer pressure to the point where they might get vaccinated, but they don't want you to tell anybody that they got vaccinated because of the peer pressure. What kind of lunatic? That's what I'm saying. And these are professional people. These are people that literally are professionals. They're great at what they do. They're good human beings. I mean, they're wonderful friends. But they are so vulnerable to peer pressure. They're vulnerable to this conspiracy crap. They're vulnerable to the Facebook social media crap. It literally infected their ability to be mature grown-ups, unafraid of peer pressure, unafraid to actually get information on their own and take care of their own health, their own families. That's how devastatingly good propaganda is. And what is the object here? Well, for the people who are already in positions of power, be they Congress members, senators, be they, state legislators, state senators, governors, for them it's a money game. For them it's a grift. For them it's a fundraising tool, okay? The ones of those who are doing it, to each other, that are doing it and they're not trying to raise money off of it, are either trying to make money off of your suffering on the back end or are emotionally immature. And it's really kind of that simple. And then there's this small little sliver of people who are doing it because they believe in fascism. What is fascism? It's minority rule. That's what basically fascism is. And they think that through minority rule and things that actually create a situation where the minority can rule, like gerrymandering or cheating at elections, suppressing the elections, subverting elections, things like that, we could get fascism in this country. And even though white people are clearly going to be either co-equal managers of this country, as the caller said, or slightly less than co-equal in numbers to people who aren't perfectly lily white, they believe that in the minority, they can still rule over the majority. That's pure fascism. Now, that is the white supremacist portion of this crowd, but it isn't everybody. And I know this because it's happening to so many people around me. Part of that is because I live in Florida. The other part is because of social media. The other part of it is because of things people read or things people are told by people who are getting their information from social media, and they want to believe it because they don't want to argue. They don't. Now, either it's a passive-aggressive personality where they're afraid of the conflict, or it's just immaturity and they're willing to go along to get along, and they don't want to, be bullied in school or whatever it is. But some people just never grew up. Some people just didn't. And it really doesn't mean that they're not smart. It means that they're emotionally operating at an emotional deficit. And it's sad because it's going to kill them or their kids. Jack in Vermont.
You're being too kind when you say that they're smart.
There are a lot of smart people that are doing this.
Yeah, I know, but I can't get there with the smart people thing. But I think it's very, you do a hell of a job. And I just have a couple of things. I look at the pandemic and global warming, all these fires, and how close we're coming to maybe no return in a lot of areas with global warming. And I look at it as it's like a perfect storm. Which one's going to get us first? I mean, the way they're acting in this country.
COVID will get you first. It's the immediate threat. Yes, it is.
Yeah, no, I know it will. I just look at it like
both of those situations are preventable. So there's my sunny optimism yet again. But let's not kid ourselves. There are school teachers who won't get vaccinated. Now, they have degrees, okay? They're very smart people. They went much further in school than I did. You have nurses that won't get vaccinated. You have doctors that won't get vaccinated. They're smart people. Understand the real situation.
This is the Randi Rhodes Show. To speak with Randi, dial 561-270-3844. That's 561-270-3844.
Wow, it's the last segment on a Friday. That went so freaking fast. All right, Catherine in Maryland. Hi.
Hi, Randy.
Hey.
My jaw was just agape with that clip that you showed of DeSantis in his press conference, the number of lies that came out of his mouth. And I'm wondering, in light of this insider trading thing with Rand Paul and the remdesivir, whatever you call it, I'm wondering if DeSantis has stock in that as well. And is he required as governor to disclose his...
Yes, he is. And, I don't know at this point if he does own some sort of a stake in Regeneron. I know that Kelly Rand Paul's wife, she ran out and bought stock in Gilead, which was remdesivir. And who knows if they're trying to make money on the back end of a disgusting disease that could be prevented. I don't know. But it was bizarre that he stood up at a press conference yesterday, Ron DeSantis did in Florida, and didn't acknowledge that hospitals are packed, didn't acknowledge the number of children who are being hospitalized with this preventable freaking virus, but instead told people that he's going to deploy mobile laboratories of Regeneron in order to... I couldn't believe it. I couldn't believe it.
It's like the Twilight Zone.
Yeah.
I really thought after we got rid of Trump, things would calm down. We'd get back to normal. And we're back to March and April of 2020, when this was all going on in New York. Yeah. And then, Marjorie Taylor, the hypocrisy of them saying, we want individuals to make their own decisions, medical decisions for themselves and their families, except when it comes to pregnant women whose fetuses never endangered anyone.
So let me explain this again, okay? I'm going to just give you a little explanation about the My Body, My Choice crowd. Again, if I decide that I'm pregnant and I just physically can't, I emotionally can't, I financially can't, I don't want to, whatever. Whether or not I keep my pregnancy has absolutely no bearing on your well-being. Zero. My body, my choice. Zero impact on you. However, in the middle of a pandemic, you refusing to vaccinate yourself against something that is endangering others, that is not a my body, my choice moment. That is endangering others. The Supreme Court has ruled about that previously in 1905 and again in 1922. The Supreme Court explicitly rejected the claim of liberty in the Constitution when it comes to the right of individuals to make decisions about their own health in instances where those decisions could endanger others. A pandemic falls squarely in the situation endangers others, that your liberty does not include endangering others. So don't get bamboozled by bumper stickers, okay? They all sound good sometimes, but when you inspect them, upon further inspection, they fall apart. They fall apart. The court made clear that restrictions imposed by the government to control communicable diseases if it has a real or substantial relationship to protecting public health, then you are not entitled to claim liberty, freedom to do nothing to contribute to the banishment, let's say, of the communicable disease. And that is why your children have to get vaccinated before they go to school. That is why you will be mandated if you're in the military, you will be mandated if you are working for a private business to get vaccinated to stop endangering others around you. And there will be no claim of liberty that will be upheld by the Supreme Court of these United States. None. Now, some of you might say, well, I have a religious exception. Okay, file the paperwork and let's see. Let's see what that's about. Other than that, the claim of I'm free not to in a situation where you're endangering others doesn't wash. It doesn't hold water. John in Washington.
Yeah, Randy.
Yeah.
Hello.
Hi.
I'm a little off subject, but this is about Trump's taxes. You know, he's fighting tooth and nail to keep them hidden. And, you know, I mean, he couldn't even be an FBI agent, you know, without showing his taxes. And he's put in charge of the FBI and the CIA and everybody else without showing his taxes. Now, my question is, why isn't the Democrats, I mean, they're in charge. Why can't they make it a law that you have to show 8 to 10 years of your taxes before you can get on the ballot, you know, federally?
Well, they could.
Federal law.
They could, but you have to look at what they're doing. I mean, right now they got a child tax credit out the door. They got, COVID to deal with. They got wars to end. They got voting rights to protect. They got an infrastructure package to get passed. So, you know, it's not.
Well, this
it's
is
not something that you have to do right now, is it?
Well, I mean, but everybody's talking about, oh, he could run in 2024 and blah blah. This. I mean, why not just make it a law? Make him show.
Well, it's not something that has to be done in 2021. So I think the priorities that the Democrats have are the priorities of the American people. I really do. Keisha in New York.
Hi, Randy.
Hey.
I wanted to tell you, I think the CDC and Dr. Fauci have done a really poor job explaining the vaccine to the American people. There's a fight now, not only for the My Body, My Choice crowd, but also the mask, debacle that's happening because schools are wanting these children who can't be vaccinated to wear the mask. I think Dr. Fauci and the CDC should have explained early on that even though you're going to be vaccinated and should be vaccinated, that you need to continue to wear the mask. In the beginning, when he was pushing this vaccine, he said, and along with a lot of the mainstream media, that you would be able to take your mask off and, be amongst your family and friends freely. But now we have the breakthrough COVID. And I think it's just a test run because they really didn't know what the vaccine, whether it was going to prevent COVID or whether it was going to block the severe lung disease that would put you on a ventilator. So I think they did a very bad job explaining to the American people what to expect and why they should be taking the vaccine, because I do believe that it probably will prevent you from, being hospitalized, but they just didn't explain it properly. They just kind of
said, they told us we could take our masks off after vaccination, we didn't have the Delta variant.
Well, you're letting people
and the reason why we have the Delta variant is because the unvaccinated have been hosting this virus and allowing this virus to mutate into a bigger, badder-ass virus. This is an epidemic of the unvaccinated. There is no question. If the unvaccinated would have been vaccinated, the virus never would have been able to mutate into the Delta variant, which is the viral load in the Delta variant is 1,000 times the viral load in the original SARS-CoV-2 virus. That's why they had to change the mask mandates to say that if you are vaccinated, you could get COVID in your nose. Your lungs won't get infected because the vaccine protects the lungs from the infection. But the upper respiratory portion of your person, the nose, maybe even the throat, can host SARS-CoV-2. That's the Delta variant, and that's why they changed the mask mandate. Now, as this thing mutates and progresses into Lambda and God knows what else, it's going to change the advice.